Hey doc, can TRT cause headaches?
That's a great question. So TRT it's very rare that testosterone replacement regimen of any kind, even steroid use, doesn't really cause headaches. But when it does cause headaches, this is what I see. It's going to be related to number one, hypertension. So you take steroids, even just testosterone, blood pressure goes up. If the blood pressure is significantly elevated, even just from your baseline, if your pressure goes up and you've probably been hypertensive already, because people have this, men are hypertensive all the time. They come to see me. And then you give testosterone, you get a little bloating, a little intravascular edema. That's called hydrostatic, right? It's hydraulic pressure. The hydraulic pressure in the system goes up, and that's blood pressure. So if you're hypertensive, that absolutely affects headaches 24/7. I mean, that's just what people know this. You know, doctors, if you have headaches and blurry vision and all this kind of different, we're always going to go for blood pressure first. So blood pressure, number one, and it can be significant. Number two, this is complicated. This is a complicated side. Androgen-induced erythrocytosis, which is the increase in the red blood cells that's known to happen to every single man to some degree. And if it happens to a significant degree where he has polycythemia, and all my patients know what this is because I'm looking at this all the time. It's really the one thing that I've really teased out in my niche of looking at testosterone, protecting the heart, looking at the blood pressure and all the vascular issues and the red blood cells. So looking at those are so important. And when your red blood cells are up, elevated, you're a man, and your red cells go up, on the CBC, the hemoglobin and hematocrit. Okay, and the RBC count, there's some sub indices there, but it's the hemoglobin, hematocrit, and of course the iron studies that I coordinate. This is called hematology. It's very complicated. As an internist, this is what I'm trained to do. I'm certified to do. When you look at it on androgen and it goes up significant, I mean really, it goes up, men have blurry vision and headaches. So that's what it does happen when men they're on TRT and they have headaches, not from something else, from stress or from migraines or from, drugs or alcohol or hangovers or chronic, it's real. Start testosterone, boom, headaches. Hey guys, quick pause here. If you're watching this video, odds are you're concerned about your testosterone levels. That's where the sponsor of this video comes in. Let'sGetChecked.com. Let's Get Checked makes professional health testing easy by letting you get tested without having to visit a healthcare provider. Choose your test online, like one of their testosterone panels, and it will be delivered to you in discreet packaging with next day delivery. Once your sample arrives in a laboratory, confidential results will be available from your secure online account within 2 to 5 days. See my link in the description for more details and discount code. Timeline, start testosterone, boom, headaches. Blood pressure, red blood cells, this is it. So I would think that those are the most common for me. And then the next thing is going to be the estrogen again, the estrogen. So guys will feel notoriously that the estrogen's gone up, it's leading to headaches. But are the red blood cells up? Check the box off, yes or not. How's the blood pressure? Check the box off, yes or not. And is testosterone and its conversion to estrogen, with or without aromatase inhibitors, is this some kind of a milieu chemically for leading to headaches? And then, doc, I need the anti-estrogens because of headaches. I've heard it. But this is a patient. This is a man that's, it's a good guy that he just doesn't know, and he's Googling it. He's Googling, just checking it. I heard this, I saw that. I have headaches, I have acne, I have all these things. I'm losing money. I'm fighting with my wife because I'm depressed. I have anxiety, panic attacks because of my estrogen. And that is not true across the board. But Can it be true? Of course. But to just blame estrogen for all these things and headaches is obviously wrong. But I will check the boxes off, the dangerous stuff, what's going on. And if a person has headaches, significant headaches, and I think it's significant enough, I always coordinate with their primary care doctor. This is why being a testosterone expert and the way I do it is it's not anti-aging. You need to be a primary care doctor because you need to know primary care issues like hypertension, like how do you diagnose and differentially diagnose and manage a headache? What the headache syndromes? I mean, there's doctors that are just headache specialists. Do you send everyone with a headache to a neurologist that's a headache specialist? You'd be wasting a lot of people's time. Do you send everyone to the ER for a CAT scan of the head because they're going to have an aneurysm? It's the worst headache of their life, and they're going to die from an aneurysm or from an intracerebral bleed? Well, I've seen all these things. So that's why you have to be so humble, I think, as an internist, not to mention a doctor of any type, when you're giving these medicines. So TRT and headaches, very complicated and rare, and again, has to be dealt with on a differential diagnosis of exclusion, where you're excluding these dangerous things and you're working down the pipe. You're working down to more benign issues that estrogen. I mean, of course, now you have to manage this stuff. So, and stress, does testosterone cause anxiety? And this anxiety works back to stress. And now I have headaches because, someone's very stressed out. This is all I do, Jake. It's very complicated, I'm very humble that a lot of times I don't know something. And if I feel like in the end of my questioning, I'm either sending them to a higher level of care, maybe the emergency room. I did it last week and it was right. We did the right thing because we found something. Guy's okay, but we found something. ER, back to the primary care, unfortunately, a walk-in clinic or somewhere. Or if the patient's stable, sending them to another specialist and we coordinate together. We did it last week. We saw a calcium score and he had multiple bilateral pulmonary nodules, but I called him right up. I assessed that he was stable, but he has some very atypical shortness of breath that's not acute. So I said, you don't need the emergency room, but we set him up with a pulmonology doctor, because this is the lung fields, right? So we found something incidentally on a CAT scan looking for plaque in the artery, which was 0, but we found something else and we got a fish on the hook, so I know where to take that fish. I know what, fishermen to bring the fish to. And that's an example of how complicated this is. So, but that's it. TRT and headaches, very rare. Thank you.